Hi, I'm Dr. Jim Craig with Summerbrook Dental Group, here to answer a question that many patients have had. If my tooth is treatable, but it's very expensive to do so, can I just pull it? It's a lot cheaper to pull the tooth than it is to fix it. You can pull a tooth, and in some cases that's the only option available. But bear in mind the long-term consequences of pulling a tooth. The bone that supported the tooth begins to dissolve immediately when the tooth is pulled, and you can lose up to 25% of the bone in 1 year's time. This can have devastating consequences long-term. In addition, when you pull a tooth, the teeth around it start to shift and move, and it can cause unhealthy forces in your mouth. You may eventually lose additional teeth because you didn't replace the one tooth that you pulled. Also, when you pull a tooth, the opposing tooth that chews against it starts to super-erupt or grow in again, kind of like it did back when you were 6 years old. And it can grow in so far that pretty soon we have to pull another tooth that would otherwise have been healthy and maintainable over the long term. My advice is always to fix a tooth if it can be fixed. In the cases where a tooth can't be fixed and has to be pulled, you should strongly consider replacing it with something to stabilize the occlusal forces in your mouth and make it so that your bite is stable long term. We don't want to pull any more teeth than is absolutely necessary. If you have questions about dental treatment or think you may need a tooth pulled, I'd be happy to visit with you at a free consultation and exam at Summerbrook Dental Group.